Hi everyone, my name is Ria Santiago Blas, and I'm going to discuss about sinus bradycardia. At the end of this lecture, participants will be able to find sinus bradycardia correctly, list all the signs and symptoms accurately, explain the pathophysiology of sinus bradycardia in detail, select the treatment for sinus bradycardia properly, and eventually develop the skills in identifying sinus bradycardia from a normal sinus rhythm effectively. These are my objectives. Let's have some exercises. I'll show you two rhythms. Can you identify the difference of the two? Yes, you are correct if you identify that they are identical. They have regular rhythm, normal B wave, QRS complex, and T wave. However, the first rhythm has a slower rate of about 50 beats per minute, and the second rhythm has a 75 beats per minute, which is normal. Therefore, the first lead is what we call the sinus bradycardia, and the second rhythm is called normal sinus rhythm. Let's define what is sinus bradycardia. Sinus bradycardia is divided into the word brady and cardia. Bradys means flow and cardia meaning heart. And sinus means the electrical impulse originate from the sinoatrial node. Therefore, the heart beats under 60 beats per minute for adults, but otherwise works normally coming from an SA node. In order for us to learn better about sinus bradycardia, we have to dig what is the electrical conduction system of the heart. The electrical conduction system of the heart starts with the SA node which fires about 60 to 100 beats per minute. Through Bachmann's bundle, it travels to the left atrium. It will be received by the SA node, which is the lower rate, and which allows the atria to complete the contraction. Then follows the pathway to the bundle of Fis, which further divided into the left and right branch for the ventricular impulse generation and will be completed by the Purkinje fibers. In this way, all this, when completed, will generate a P, QRS, and T wave rhythm. In this image, we'll see how a typical heart rhythm versus bradycardia occur. And a sinus node impulse, there have to be appear a normal firing of 60 beats per minute, received by the AV node and travel through the ventricular impulses, which is divided into left and right bundle branch, and to the Purkinje fibers. However, in sinus bradycardia, the sinus node sends impulse too slowly. It will not achieve a 60 beats per minute, but the pathway remains the same, which appears to have a normal morphology and contraction. So a typical heartbeat would have normal heart rate with a morphology of PQRS and T wave, while a bradycardia or a sinus bradycardia would have the same pathway, the same PQRS and T wave, however, with a slower rate because the SA node firing. Now let's have identify what are the causes of the sinus bradycardia. It can be either caused by old age, which it tends to be normal when the patient is over 65 years old, then SA node is aged as well. Second one, with the athlete with regular exercise and training. Exercise has a positive impact on your vagal nerve. That's why it decreases the heart rate through time. However, there are circumstances or cases that will lead to real sickness, such as sick sinus syndrome, weak and damaged heart muscle, raised intracranial pressure, low thyroid hormone, drug toxicity from beta blockers, calcium channel, and digoxin intake, electrolyte imbalance such as hyperkalemia, and stimulation of vagal response. Let's discuss each one. In sick sinus syndrome, the SA node is already damaged, so the function of the SA node is not optimized. In this case, the patient needs permanent pacemaker. The next one will be weak and damaged heart muscle may be related to ischemia, infection, or inflammation. When the SA node has no ample amount of blood supply, then it will be damaged and will not function as expected. In this case, heart rate will be slower. In cases of brain injury, raised intracranial pressure is expected. Together with that, heart rate will be increased, we'll have a wide pulse pressure, and also a irregular breathing. The next one will be a low thyroid hormone, which is expected for hypothyroidism, will give you a lesser heart rate. When a patient has beta blockers intake or a calcium channel or digoxin, which halt or stop the contractility and chronotropic effect, then this heart rate will be lessened. In this case, we have to stop the drugs that causes the toxicity. In cases of severe hyperkalemia or electrolyte imbalance, heart rate will be less as well. And in cases of stimulation of vagal responses, the vagal nerve, if stimulated more than normal, then heart rate will be decreased. Such a scenario is a vomiting. There are other causes such as valve replacement or radiation therapy and rheumatic heart diseases, which also lead to decreased heart rate. Since we know already the causes, then we go to the signs and symptoms. If it's normally appearing, then there is no visible signs or manifestations. The patient appears to be stable. However, if the cause the comorbidities, then it will be having a reduced oxygenation because of reduced contraction and blood supply to the body and to the organs. You'll, you'll experience shortness of breath, dizziness, and fainting. Can also be with fatigue, weakness, mental confusion, chest pain, and sleep disturbances. In these cases, nursing responsibility needs immediate action. Now we'll go to the nursing responsibilities regarding sinus bradycardia. If the patient has asymptomatic, then no treatment is required. However, if it's symptomatic and unstable, we have to first identify the cause. How to identify it is to identify first and assess the signs and symptoms the patient is manifesting. Always maintain a patent airway and administer oxygen as required when the patient is having trouble of breathing. Vital signs and 12-lead ECG is a must, and if it's non-persistent, patient can be monitored and observed. However, if the patient has a persistent symptoms which causes hypotension, altered mental status, signs of shock, ischemic discomfort, and acute heart failure, then you have to intervene fast with the atropine 1 milligram IV as per physician order. You can repeat this medication every 3 to 5 minutes for a total of 3 milligrams only. Remember that atropine blocks the activity of the vagal nerve, so it increases the heart rate. If it's ineffective, then the physician can proceed to a transcutaneous pacing dopamine infusion of 5 to 20 mics per kg per minute and epinephrine infusion of 2 to 10 mics per minute. Transcutaneous pacing is the placement of electrode in the chamber of the heart, so the rate and output will be increased as well as the contraction of the heart. Dopamine infusion, on the other hand, is a positive chronotropic and inotropic drug that will increase our heart rate and contractility. And epinephrine, lastly, is a symptomatic medication that will increases your blood pressure, heart rate, and it will increase as well the contractility that mimics the sympathetic nerve activities. And this image is a pacemaker. This is a permanent pacemaker, which is a battery-operated one, connected and place the electrodes in the chamber of the heart, either with single chamber, dual chamber, or a biventricular chamber to regulate the SA node. It's actually to replace the damaged SA node that's not working properly. This will be the heart's pacemaker and will control the heart rate and will reduces the mortality and comorbidity and complications related to sinus bradycardia. In summary, let us define that SA node fire at 60 to 100 beats per minute, and the sinus bradycardia is therefore a rhythm that meets the criteria for normal sinus rhythm originating from the SA node, but has a slower rate of less than 60 beats per minute. Treatment will be according to the causes it occurs. And always follow the ACLS guideline for bradycardia algorithm for symptomatic and unstable patients. I have some questions and answer here. What is the natural pacemaker of the heart? Yes, it's the sinoatrial node. These are my references for this lecture. I hope it will be useful for you for your further investigations. Thank you very much.